Major medical expense plans insurance exam prep. Question 1. Comprehensive major medical plans combine the features of life and health insurance, basic medical and major medical policies, HMOs and PPOs, Medicare and Medicaid. Comprehensive plans wrap basic first dollar/low deductible coverage and catastrophic major medical into a single policy. Question 2. What is the typical initial payment an insured must make under a comprehensive major medical plan before benefits are paid? Co-insurance, flat deductible, corridor deductible, stop loss. Comprehensive plans usually have a flat upfront deductible, example, $500 or $1,000, rather than a corridor deductible. Question 3. After the deductible is met, what cost-sharing mechanism kicks in? Co-payment, co-insurance, indemnity, stop loss. Co-insurance, example 80/20ths, begins immediately after the deductible is satisfied. Question 4. The maximum out-of-pocket (MOOP) limit includes deductibles, co-insurance, and co-payments. Only the premium, only the deductible, only out-of-network charges. MOOP typically accumulates the deductible, co-insurance, and co-pays to determine when the insurer will start paying 100%. Question 5. Are pre-existing condition exclusions allowed in major medical plans under the Affordable Care Act, ACA? Yes, always. Yes, for up to 12 months. No, they are prohibited. Only for tobacco users. The ACA outlawed pre-existing condition exclusions for all major medical health insurance plans. Question 6. Which of the following defines an essential health benefit under the ACA? Elective cosmetic surgery, maternity and newborn care, adult dental care, long-term care. The ACA mandates 10 essential health benefits, which include maternity, emergency services, and prescription drugs. Question 7. True or false, lifetime maximum benefit limits are permitted on essential health benefits under current major medical plans? True, false. The ACA prohibited lifetime and annual dollar limits on essential health benefits. Question 8. A young adult can stay on their parents' major medical plan until what age? 18, 21, 26, 30. The ACA allows dependents to remain on their parents' health insurance plan until their 26th birthday. Question 9. What type of network do preferred provider organizations, PPOs, use? Closed network only, in-network and out-of-network coverage, gatekeeper only, government doctors only. PPOs allow patients to see out-of-network providers, though they pay higher out-of-pocket costs compared to in-network. Question 10. How do health maintenance organizations, HMOs, typically control costs? By requiring a primary care physician, PCP, gatekeeper. By having unlimited deductibles. By excluding prescription drugs. By encouraging emergency room visits. HMOs use a PCP to manage care and require referrals to see specialists, keeping costs down. Question 11. Which major medical plan type generally does not cover out-of-network care except in emergencies? PPO, POS, HMO, indemnity plan. HMOs operate on a closed-panel network and generally will not pay for non-emergency out-of-network care. Question 12. What is a point-of-service, POS, plan? A plan that only covers point-of-sale drugs. A hybrid of HMO and PPO features. A Medicare supplement. A basic hospital plan. A POS plan has HMO features, PCP, referrals, but allows out-of-network care like a PPO at a higher cost. Question 13. Which of the following represents preventative care coverage under ACA-compliant major medical plans? Covered at 50% co-insurance. Covered at 100% with no deductible or copay. Not covered. Requires a $500 deductible. Routine preventative care, like annual physicals and screenings, must be covered at 100% in network without cost sharing. Question 14. What is a copayment? A percentage of the total bill, a flat dollar amount paid at the time of service, the annual limit on expenses, the monthly premium. A copayment, copay, is a flat fee, example $20, paid for a specific service or prescription. Question 15. A grandfathered health plan is a plan purchased before the ACA was enacted that is exempt from some ACA rules. A plan only available to senior citizens. A Medicare plan, a plan that covers extended family. Grandfathered plans existed before March 23, 2010, and are exempt from certain ACA mandates as long as they don't significantly change. Question 16. Under a major medical plan, what is a formulary? A list of network doctors, a list of covered prescription drugs, the claim submission form, the schedule of surgical benefits. A formulary is a tiered list of prescription drugs covered by the insurance plan. Question 17. Which metal tier under the ACA generally covers 80% of actuarial costs? Bronze, silver, gold, platinum. ACA tiers cover actuarial value: bronze, 60%, silver, 70%, gold, 80%, and platinum, 90%. Question 18. What happens if an individual uses an out-of-network provider in a PPO plan? The claim is completely denied. They will likely have higher deductibles and coinsurance. The doctor will be arrested. The provider must accept in-network rates. PPOs cover out-of-network care, but the insured bears a larger portion of the cost. Question 19. What is a gatekeeper in an HMO? The hospital admissions clerk, the insurance agent, the primary care physician, PCP, the claims adjuster. The PCP is the gatekeeper because they must authorize any referrals to specialists or hospitals. Question 20. True or false, major medical expense plans typically cover routine adult dental and vision care. True. False. Routine adult dental and vision care are traditionally excluded from major medical plans and require separate standalone policies.